Good morning. Welcome to the Subcommittee on Life and Health. And I do have to explain there was a change of time, so we appreciate everyone being here and be able to make this meeting. Before we begin, we will start with a word of prayer. Chairman Lumsden, if you would give us a word of prayer, please.
You would bow with me. Almighty, most holy God, faithful through the ages, we thank you so much for all of your many blessings. We thank you for life and health, for family and friends, for watching over us and caring for us. We thank you for the opportunity that you've given to each of us to serve in this way, the people of the state of Georgia. We just ask that as we deliberate, as we make decisions, that you would give us your wisdom, your guidance, and all that we do might be to honor and glorify you and serve the people of this great state. We ask, Lord, that you would bless those in Ukraine, in this war-torn portion of our world. We ask that you would give them peace, that you would give them grace, that you would help through this difficult time, and just ask for your will to be done in all that goes on there. We ask this in Jesus' name for his sake. Amen.
Thank you. We have a couple of bills. This is hearing only. We will be hearing bills today. And those that cut the mustard will move on to full committee. Okay, we'll start with Senator McNeil, if you'll come to the table.
This is heavy. Good morning.
Good morning.
Senate Bill 487 aims to diagnose breast cancer earlier by eliminating the patient's out-of-pocket costs for medically necessary diagnostic and supplemental breast examinations. Eliminating out-of-pocket costs for diagnostic imaging would improve access and lead to more patients receiving early detection services. Typically used as a follow-up test after an abnormal find on the screening mammogram or clinic breast cancer, diagnostic breast imaging is an essential tool in the screening and diagnosis of breast cancer. Additionally, this legislation is critical for breast cancer survivors, as diagnostic imaging is typically recommended as primary breast imaging for breast care survivors. A screening mammogram would not be considered successfully complete if the follow-up diagram imaging would not perform to rule out breast cancer or confirm the need for a biopsy. If individuals are unable to afford the cost associated with diagnostic imaging, many might delay or forego follow-up tests to rule out or confirm a breast cancer diagnosis, leading to a late stage diagnosis, making it more deadly and more costly to treat. In 2022 alone, 9,170 people in Georgia will be diagnosed with cancer, and the 1,410 will die from the disease. On lines 23 to 24 and lines 37, we included specific standards that define what is medically necessary by the National Comprehensive Cancer Work. Lastly, to comply with federal law around high deductible plans, we added new language in lines 51 to 59. I'll now turn it over to Leah Hines with the Coleman Foundation via Zoom, and she will tell you a little bit more, be a lot better than I would be, about some of the changes that were made.
Thank you. Do we have on Zoom? If you
Yes, hello, good morning. Can you see me and hear me?
Yes, go right ahead, please.
Thank you so much. Good morning, Chair Taylor and members of the committee. My name is Leah Barber, and I'm the Regional Manager for State Policy and Advocacy in the Southeast for Susan G. Komen. Thank you for the opportunity to provide testimony in support of Senate Bill 487, which aims to diagnose breast cancer earlier by eliminating patients' out-of-pocket costs for life-saving, medically necessary diagnostic breast exams. Komen is committed to supporting those affected by breast cancer today while tirelessly searching for tomorrow's cures. Widespread access to preventive screening mammography is available to millions of women as a result of the Affordable Care Act. Unfortunately, if the results of the screening mammogram require a follow-up diagnostic exam, such as an MRI, ultrasound, or diagnostic mammogram, to rule out breast cancer or to confirm the need for a biopsy, the patient will likely face hundreds to thousands of dollars in out-of-pocket costs. And this is all before they even begin their treatment. An estimated 16% of women screened with modern digital mammography will require follow-up imaging. A screening mammogram would not be considered successfully completed if the follow-up diagnostic imaging were not performed to rule out breast cancer. Aside from follow-up testing, diagnostic imaging is also recommended as primary breast imaging for breast cancer survivors, women who are at high risk for breast cancer, and those who have undergone a lumpectomy followed by radiation therapy. We often receive calls and emails from women who are unable to afford the out-of-pocket costs for their diagnostic imaging services. Without some assistance, many of these women will simply delay or forego their medically necessary imaging, leading to later stage diagnoses. These delays can mean that they will not seek care until the cancer has spread, and we know that a diagnosis at a later stage makes breast cancer much deadlier and up to 5 times more expensive to treat. We also know that the 5-year survival rate for women and men whose breast cancer is contained to the breast is 99%. Once breast cancer metastasizes to areas outside of the breast and surrounding regional lymph nodes, often to the bones, liver, lungs, or brain, the 5-year survival rate drops to 27%. Research shows that despite recent scientific advancements, there are widespread racial health disparities in breast cancer. According to a new in-depth report from Susan G. Komen, the breast cancer mortality rate for Black women is higher than that of white women in nearly every county in the Atlanta metro area. Atlanta is one of the 10 cities with the highest mortality rates for Black women. Excuse me. Eliminating patient out-of-pocket costs for needed diagnostic imaging can help to create a more equitable and accessible breast cancer screening and diagnostic system in our country. COVID-19 has also created significant delays in annual breast cancer screenings, and experts have warned that missed cancers might be larger and more advanced once ultimately detected, often requiring the use of diagnostic imaging. Senate Bill 487 only pertains to health plans that already provide coverage for diagnostic imaging services, simply addressing the required cost sharing for such services. This bill does not mandate that health plans provide any additional coverage. Additionally, Senate Bill 487 requires that supplemental or diagnostic imaging services be medically necessary and clinically appropriate. In this committee substitute, language has been added to ensure compliance with federal law with respect to high deductible plans with health savings accounts. In recent years, several other states have passed this vitally important legislation, including Arkansas, Colorado, Illinois, Louisiana, and Texas. We urge you to join these states in ensuring that all Georgia patients have fair and equitable access to medically necessary diagnostic services by supporting the passage of Senate Bill 487. Thank you very much for your consideration and for the opportunity to be here today.
Thank you very much for sharing this information with us. I will tell you, are there any questions from any members of the committee? Okay, we do have someone that would like to speak to the bill. Becky Riles, if you will go to the podium, please. Identify yourself.
Good morning, Madam Chair, members of the committee. I'm Becky Riles, representing Management Services Network, which is the administrator for the Georgia Radiological Society. GRS supports Senate Bill 487 and appreciate Senator McNeil bringing this forward. Georgia Radiological Society supports Senate Bill 487 for 3 reasons. 1, research shows without a shadow of a doubt that screening and early detection of breast cancer saves lives. Secondly, technological advances in medicine allow for earlier detection of breast cancer, which results in less invasive treatment plans, which allow women and men to get back to work, get back to their families, and enjoy a higher quality of life. Finally, we learned through the Speaker's mental health parity bill that we don't talk anymore about MLR. It's not medical loss ratio, it's medical spend. It's medical spend. And we know with Senate Bill 487, insurance companies will have less medical spend on treatment, and it will result in women and men's lives being saved. And for these reasons, the Georgia Radiological Society strongly supports Senate Bill 487. And we respectfully ask you, Madam Chair, members of the committee, Chairman Lumsden, to do the same. Thank you.
Thank you very much. Are there any others that would like to speak to the bill? Anyone online? Okay, we are not taking a vote. I do want to make sure everyone knows we are working off of a substitute. That number is LC 520128S. Thank you very much. We will wait a moment. We have another bill, and the author of the bill is not here. We will give him a couple minutes to get here. Thank you. We'll be at ease.
I failed to introduce the gentleman, the sitting to my right. Red has been wonderful to us and from the very beginning was excited about being able to do this. So,
Thank you very much for coming. Your support is greatly appreciated. Thank you. Okay, since we do have another committee, I will call us back to order. We will be having another meeting upon adjournment of this meeting. PNC meeting will meet. So I'm going to go ahead. This is my senator's bill, and I'm going to go ahead and present the bill for him. This is Senate Bill 566. We're working off of LC 520127S. This is a bill that has to do with our making things better through our surprise billing and Consumer Protection Act. And it has to do with the emergency services. And we originally, when it was begun, it was to add our mental parity information with it. And it also goes along to make sure that when a patient has been admitted for an emergency services, that their continuity of care will be continued. You won't have to make them move automatically to another facility, and it will be better for the patient's continuity of care. Again, it defines what the emergency services are, and I'll be happy to answer any questions. I don't see any. Now, we do have several people that want to speak to the bill. Let's see, first up will be Laura Colbert, if you'll go to the podium.
Morning, Chairwoman. I'm Laura Colbert. I'm with Georgians for a Healthy Future. We advocate on behalf of consumers across the state. And we are very involved in the passage of the original surprise billing legislation. We're supportive of this update. We believe the clarifications are important and necessary for consumers. We are very pleased to see the explicit inclusion of mental health and substance use under the emergency services definition, and the clarification around post-stabilization care helps align Georgia law with federal law. And so we believe that these are positive steps forward for the bill. So thank you very much.
Thank you for sharing. Anna Adams, if you'd come to the podium.
Good morning, Madam Chair, members of the committee. Anna Adams with the Georgia Hospital Association. On behalf of our more than 160 member hospitals, we are very proud to support Senate Bill 566. I'll echo Ms. Colbert's thoughts that this does sort of marry the federal statute with the state statute, and we think clarifies any confusion between the two. And then again, very excited to see the mental health piece added to this legislation. So I'm happy to answer any questions if there are any. We would appreciate your favorable consideration at the appropriate time.
I don't see any questions and I don't see any online. Thank you very much for sharing. Jesse Weatherington, if you'd come to the podium.
Yes, ma'am. Good morning, Madam Chair. Thank you for letting me be here today. I'm Jesse Wethington with the Georgia Association of Health Plans, which is the commercial trade group representing the health benefits industry in the state. We're seeking a clarifying amendment to Section 2 of this bill. I understand there's a substitute. Have not been able to review that this morning, but we provided language to the chair in terms of our suggested rewrite to make Section 2 a little bit more clear.
Can you speak into the mic a little better?
Yes, ma'am. Is that better?
That's better.
So our suggested amendment would just replace Section 2 with verbiage that says nothing in this code section shall affect a covered person's financial responsibilities with respect to non-emergency medical services received from a non-participating facility. We feel like that's a more succinct and clear way to address the intent of Section 2 versus what the original bill, but again, there is a substitute. So
I think this may be in the bill. It's,
Okay.
It's under E, Section 2.
yes,
Do-
ma'am.
Do you have the substitute?
I do not.
Okay, we've got a copy of it. Can you get him a copy of it? Okay, is that the amendment you were talking about?
Yes, ma'am. I believe that addresses our concerns.
Okay, so it is in there.
Thank you very much.
You're welcome. Thank you. Are there any others that would like to speak to the bill? I don't see any questions. And at this time, I would thank everyone for being here, and the meeting is adjourned.
Let's get you set for credit repair first.
Okay, we're going to get this property and casualty subcommittee underway. We had a
Their life and health. We're being seen.
we had an earlier meeting. We already opened in word of prayer, but as always, we ask the Lord to watch over everything we do and guide us in all that we do. Today we have a bill from Representative McLean. We're working off of LC 393332. Is that correct?
That's correct.
Okay. Representative McLean.
Thank you, Mr. Chairman. And thank the committee too for allowing me to present HB 1571. Let me just give you some background on HB 1571, and I think that'll help you a little bit. About 4 years ago, my intern was going to school at Georgia State, and he was at the stoplight. And he was at the stoplight, and when he was at the stoplight, he got hit in the back. And when he was hit in the back, it was a moped. And so a person on the moped hit him in the back. Police came, and the police came. They tried to get information from the moped driver, but she didn't have any insurance. She didn't have anything. So when the ambulance came, she didn't have anything. So he was late coming in, and we talked, and he says, I just can't believe she didn't have no insurance. She didn't have anything. And then the officer says, mopeds don't have to have insurance. And I says, wow. So he says, we need to do something. So anyway, so this is 4 years ago. I kind of moved it along. I'm glad that but we've got to do something because as a college student, he had to pay that $500 deductible to get his car fixed because there was no insurance. And so I guess liability or whatever that he has, but he still has to pay the copay, which was the $500. But also, I say that, but I'm just saying, what if the moped would have hit a pedestrian, and so there was no insurance. So, but if you look at the bill, line 17, 18, 19, and 20, that just says no person shall operate a moped upon the highways in the state unless such moped is covered by a form of financial responsibility, which provides for the ability to respond and damages for liability on account of accidents in the map specified in subparagraph A1A of Code Section 33-7-11. And all that is saying is the same thing is they must have some kind of form of liability. I mean, they should have some responsibility if they are the ones who caused the accident.
That would be a certain CC does not have to have insurance. And they're considered as almost as like a bicycle or something. Okay, are there any questions from anyone on the committee? Chairman?
No questions per se, but I see the insurance commissioner's representative is here. Wondered if he might have some comments regarding how this actually is in the state of Georgia at the present time, and so, clarify for all of us what the law is governing that at the present time. Weston.
Thank you, Mr. Chairman. Weston Burleson with the Insurance Commissioner's Office. I shared this with our team when you sent it over last week, and the feedback I got was that it probably makes some sense to make sure that these folks are insured. So I think I can't speak to exactly what the law says at the time, but it seems like if there was mandated coverage, we wouldn't need this legislation.
All right, thank you very much. Appreciate that. Okay.
28. Carolyn.
Thank you, Mr. Chairman. No problem. Before the insurance commissioner person left, why would we allow them to operate on the roadways if they don't have insurance? Or should they be restricted from the roadways if we're not going to compel them to have insurance? Should be one or the other, in my opinion.
Yes, sir. I think that, again, I'm not sure. I'd have to look a little more at what the law currently says, but I think that would be sounds like a decision for the legislature. If that's, again, if that's not the case, then I think we have a conversation. And I mean, it would make sense to, if they're on the road interacting with cars, they should probably have insurance.
So right now, then we're treating them like a bicycle. Is that what we're doing? Okay.
The same questions could be, this probably needs to be looked into as this bill brings before us, but bicycles are allowed on the road also. So we got to, a bicycle going 40 miles an hour hits the back of a car, it's serious damage, and both physically and health wise. I mean, damage to the cars. But this bill brings this to light, and I'm Chairman Lunston.
Are they required to have a tag? Mopeds are not required to have
No,
a tag.
mopeds are not required to have a tag, and that was the reason when I tried to the registration rather is the problem.
Right.
They are not required to have registration, and that was the reason I think that we need to do something, because bicycles are not required to ride down the middle of the road. Normally they ride in a bike lane or on the side of the road. But I do understand Mr. Chairman's point of view, but registration is not required for the moped, nor is the golf cart, things of that nature. But and I think the Department of Revenue is one of the reasons that when I brought this 2 years ago, they were concerned because it created more work.
Right. Well, I get that, but from the standpoint of enforcement, without the registration, it makes it more difficult to enforce, because with the tag database that we currently have on automobiles and that type of things, that's pretty. It's a better way of going about, enforcing or knowing whether people have or do not have the insurance. But that's interesting. The moped.
Yeah.
All right.
Yeah. Mr. Chairman, my only concern is I think that there are several states that do require that mopeds have something, and I'll try to get a little more information too on those states that require mopeds to have some form of liability insurance for those kind of accidents.
All right. Thank you, sir.
Chairman Williams.
Yes, sir. To the author, thank you for bringing this bill. I was going to ask, you mentioned golf carts, but some of these communities where street legal golf carts, obviously they're heavier than mopeds. They can go 40 to 50 miles an hour. Would it not be prudent to add maybe golf carts in this bill, or would that be something you might want to do at a later time?
I would like to, thank you very much for that question. I would definitely like to see that, but right now I'm, the reason this bill was bought, Michael Richards was attending Georgia State, and he was at the stoplight, and this moped hit him in the back, and he had come up with $500 as a college student, and I would like to see it, at least addressed.
Right. Thank you.
Representative Hughley.
Mr. Chairman, and to all the chairmen here, maybe we should take a look at doing a study committee on this topic to include other forms of vehicles, because we have a multitude of vehicles on our roadways now that were not anticipated when some of these laws were put into place. For example, as he said, golf carts, traditionally golf carts would be covered by your homeowners because it would be something that would be used off roadways. But now there are certain communities, and even in Columbus now, you got golf carts running up and down the street, but the law is not very clear in terms of how they are to be used. Same thing with mopeds. There are people in my community that is their primary means of transportation. So I would suggest that, first of all, thank the author for bringing this to the committee's attention, but I would suggest that we look into it more formally and come back with legislation to address it.
Thank you. I do appreciate bringing it to attention because sometimes things like this don't pass through your head that there's a problem. But in different parts of the state, as Chairman Williams mentioned about golf carts, we have golf cart communities. Some people don't allow them on the road. Some places do. And bicycles, where we live, bicycles ride just like motorcycles. They ride too. They literally ride side by side down the lane and have to be passed in the opposite lane. There's no bike lanes. They're just roads. And on rural highways, it's just again something that might need to be looked at. And I appreciate you bringing it. And this is a hearing only. And so if we have, do we have anyone else that wants to speak? Oh, online, I'm sorry. Representative Casualty.
Good morning, everyone. And thank you, Mr. Chairman. I just have a quick comment to this when we talk about bicycles. I remember Todd Jones and we co-sponsored a bill that regulated how cars can now pass bikes when there is a median, and that we treated it similar to oh God, I'm blanking on the word right now, to some form of official truck. Sorry, I'm going blank, but the reason we did this is because bikes are the weaker forms of transportation on the roads. I mean, if you're on a bicycle, I'm a biker, if I go really fast, I can hit 30, but that takes some effort. So I'm in a dangerous speed zone. With mopeds, the problem is, and I appreciate Representative Dewey bringing this bill, they can drive all over the roads. So I think it really merits further investigation or further research of how we should treat them. I know that in other states, they require a tag, and that may be something, but my question is, and maybe this was already answered before, how are bicycles and mopeds currently insured if they are not wearing a tag? That all goes through the homeowner's insurance or our own liability insurance. Is that correct? I'm not an insurance person, so maybe that's a question I need some clarification on.
Yes, ma'am. Thank you. We had a representative, Lee Hawkins, I believe, introduced a bill a couple of years ago to put tags on bicycles, and it wasn't received very well. So it's something we need to look at. And Representative McLean, appreciate you bringing this. And
thank you, sir.
We will, the full committee will take what we've heard here today and make a decision on where we move next.
Thank you, Mr. Chairman. Thank you, all committee, for allowing me to present, and do hopefully that I do, Representative Hughley, thank you very much. And I do think that we just need to do something.
Well, does anyone else in the audience have anything to say about this bill in any way, any manner, or for or against? You for it or you against it, either way. All right, meeting adjourned. Thank you.
Thank you.